The next intervention I want to talk to you about is called pivotal response training. The main goal of this intervention is to focus on some pivotal areas. And the idea is if you focus on these areas that are really can generalize really quickly, then you don't have to teach each thing separately. So a major focus on one of those areas is to make sure that you're always using something that they're motivated by. Motivation is a huge part of this. Motivation to initiate and to respond appropriately. So they use things like child choice, of course, reinforcing the child's attempts. A big thing they talk about in this technique is interspersing previously learned tasks so they have some behavior momentum. So if you're teaching something new that's really hard, they also want you to go back and teach some really easy things, or rather elicit some really easy things so they don't just feel unsuccessful the whole time. So they definitely want you to intersperse some things they already know with new things. And this particular type of intervention is based on the principles of ABA, but it differs. The professors, what do I want to say, interventionists that came up with this, Dr. Bob and Lynn Cagle, they have a history in ABA. Actually, she also has a master's in speech language pathology. So they were coming at this treatment of children with autism with a vast knowledge of language development and just the behavioral theory behind language. So in a response to DTT, they said, okay, but there's also another way we can do it, still using these behavioral principles. But it looks a lot different. It's in a most inclusive setting, so it might be in a very naturalistic, like classroom setting, versus at the table. It's not a ton of hours of intervention. Intervention is delivered by multiple people, not the same therapist all the time. The target behaviors might morph over time. Versus when you saw in that DTT example, it's very structured, repetitive. PRT could look like that. It just depends on what your student's doing. It's much more child-led and directed, but it's very much reinforced. And if it's something motivating to them, then a lot of other skills follow once they realize the power of their communication, just like in those other interventions I've talked about. So this video I have for you is a clip of Dr. Lynn Cagle was on a TV show called Super Nanny. That was on probably 10 or 15 years ago, where this British nanny would come into these homes and help parents with kids with problem behaviors. And it's interesting because the reason Super Nanny was called onto this kid is for disruptive behaviors, but really the child just has autism and has no way of communicating. And so Super Nanny says at the beginning of this clip, I knew that I had to give this child some way to communicate. Like that was a major reason for all these behaviors, which is almost always the case. And so she brought in Dr. Lynn Cagle, who I was talking about as kind of the author of this theory, along with her husband, this treatment. And so it's a really good example of what I'm talking about very child oriented. If you didn't know what you were looking at, you wouldn't even realize that it was any kind of intervention at all, because it's just very, very natural and very child led. So make sure you take a look at that.